Hi, this is Congressman Steve Israel. It's Sunday, March 21st, and tonight we'll be voting on health insurance reform in the United States Congress. I'm voting yes, and I wanted to explain my reasons. I'm not voting yes for my president. I'm not voting yes for the Speaker of the House. I'm not voting yes for my political party. I'm voting yes for middle-class and working families that I represent. I'm voting yes because of the small business owner who called me last week to complain that he received a 22% increase in his health insurance premium this year, and he expects that he'll receive those increases for the next several years. Under this bill, for the first time, that small business will be able to enroll their employees in a new private sector health insurance market exchange. They'll be able to shop for the best health insurance at the lowest rates. I'm voting for this bill because of the woman who called me recently and told me that her daughter with breast cancer was denied health insurance because the company treated that breast cancer as a pre-existing condition. Under this law, no health insurance company in America will be able to deny anyone who pays their premiums the coverage that they deserve for a pre-existing condition. I'm voting for this bill because of the retired plumber who came to my door recently in Dix Hills. I thought he was coming to the door to urge me to vote against this health insurance reform bill. Instead, he said, "You got to vote for it." He said, most people don't realize that when they lose their job, they may lose their health insurance. Under this bill, if you do lose your job, you will receive health insurance. You'll be able to shop for insurance on that private health insurance exchange marketplace. I'm voting for this bill because the middle class and working families have always been the backbone of our economy. Unfortunately, the middle class and working families have been undermined by skyrocketing health insurance costs and by the economic insecurity that comes with insurance. We're now going to provide new initiatives for the private sector, not the government, to offer insurance to as many as 30 million additional people. And those new premium payers will provide a new base of financing for health insurance companies, and that will make the economics work better. For 8 years, we ignored this problem. From 2000 to 2008, health insurance premiums doubled. Health insurance company profits quadrupled. Over 6 million more Americans became uninsured. And as a result, today, the leading cause of personal bankruptcy in the United States is unpayable medical bills. We cannot continue to do nothing. Now, some people say that this is unaffordable. What's unaffordable is continuing the 8 years of policy in the past. We cannot continue to do nothing. In fact, the Congressional Budget Office just released its confirmation, its certification yesterday, that this is an important deficit reduction tool. Not only is it fully funded, fully paid for, but it's going to save $140 billion over the next 10 years and over $1 trillion in the 10 years following that. This is important for Long Island. It's important for our small businesses. It's important for the small business in East Northport that can't afford premium increases, for that woman in Huntington Bay whose daughter was not going to receive insurance because she was diagnosed with breast cancer, for people who currently don't have the health insurance they need. Now, some people are skeptical about this bill, and I understand that. In 1965, a majority of Americans were skeptical about Medicare. In fact, the Gallup poll during that vote suggested that only 42% of the American people supported Medicare. We didn't listen to the majority in that poll, and it's a good thing, because had we wouldn't have Medicare today. And Medicare is the backbone of economic security for senior citizens. If I were here in Congress in 1965, and the choice was between voting for Medicare and risking my seat in Congress, or voting against Medicare and saving my seat in Congress, I'd have voted for Medicare. There's no difference today, and that's why I'll be voting for this bill today. The largest increase in middle-class security in recent history. You can take a look at a copy of a speech that I gave in Congress supporting this bill simply by clicking below this video. And I've included in my website a rather comprehensive question and answer fact sheet and chronology that should help you with any questions you have. Also call my office at 631-951-2210 and we'll help provide additional answers. Thank you very much and God bless you.